Well, welcome back, everyone. You know, measles is on the rise, and here to talk about that is Brandon Fischer. He's the health commissioner for the Allen County Public Health. Welcome, Brandon.
Hi, welcome.
All right, so measles, it's on the rise, you know. First of all, how do you get it?
So measles is spread through the air. The big thing about measles is it's exceptionally contagious. It's one of the most contagious viruses that we have out there. It spreads basically when someone coughs, it gets into the air, and then it hangs in that air for up to 2 hours afterwards. If you're not vaccinated against measles or didn't get the MMR vaccine, you have about a 90% chance of catching the virus. So it is that contagious. So that is the main means that it's spread. And we just try to push that it's important to get that vaccine because it can be pretty serious virus for individuals when they catch measles, that it can get them really sick over a period of time and could have lifelong impacts on them as well.
Yeah, so we just, you know, we talked about how easy it is to get measles, but what does it actually do to your body?
So measles, at least initially, your initial symptoms, you may have red eyes, runny eyes, kind of like a pink eye type situation. You can get a fever. It can get up to 105 degrees. So that's pretty high fever, cough, runny nose, what have you. But then after about 2 to 4 days, then you start to get this rash that appears on your body and starts like head down and really has an impact on you. A lot of people, it can be limited to that, but in about 20% of people who catch measles, they could be hospitalized due to some of the symptoms that they have. And then it can go further. It can cause encephalitis or pneumonia. And in 1 to 3 of every 1,000 people who catch measles, they could die from that virus. So that's why we're trying to limit some of that spread, because while it may not be, you may not be the one, the odds are not in your favor with just not only being hospitalized, but also potentially passing away from the virus.
Yeah, are there certain people that could be at risk for those, you know, tremendous health issues, you know, such as death?
So the people that are most at risk are under the age of 5. With hospitalization, it's people who are under the age of 1. Typically, individuals that are 12 months or younger are not eligible for the vaccine, so they do not have that immunity that's built in so that they could be seeing worse outcomes from the virus. So that's usually the group that you're most trying to care for and trying to limit some of that impact of the virus for them there. And then that's why we really push to make sure that most, if not everyone in the community has that vaccine, because until you're about 1, you're not able to respond as well to the vaccine to give yourself that protection. And by having everyone in the community have that protection, you limit the number of people who could potentially catch that virus and then spread it to our newborn children, infants who are soon to be, you know, walking, talking, and, you know.
Yeah. Yeah, so Brandon, we're living in a digital age, which means, of course, a lot of digital misinformation that's out there. You know, you're not going to cure it by, you know, taking cough syrup or anything like that, you know. Is there a lot of misinformation that's out there that you are recognizing or hearing about?
So the biggest thing that we're hearing, at least misinformation-wise, is just that the vaccine doesn't work or that the cases are coming from the vaccine. We just had our first case in over 25 years here in Allen County, but we've given out hundreds of thousands of doses of the vaccine. So it's not likely that that was where it came from. It was the individual was exposed somewhere and caught the virus from that. There are different means that you can take to protect yourself from long-term outcomes. The CDC is stating that under the care of a physician, vitamin A can help, but it's not a cure. And the unfortunate thing in other areas where there are outbreaks of measles, there are parents that are trying to really push vitamin A to their children, and it's having that impact on them where you're not seeing vitamin A toxicity in the children, and it's impacting their liver. So that's where some of those recommendations are good to have, but not done on your own under the supervision of a doctor. If you're deficient on vitamin A, that's a good thing to get, but that's going to be a conversation with a medical physician that would be able to take care of that situation, not something that you try to dose on your own and hope that it's going to turn out well for you.
Yeah, trust the professionals and don't go through searching through Google, I guess you could say, to self-diagnose and to, self-treat.
Correct. We want to make sure that we're trying to avoid anything like that, to make sure that people are getting the vaccine to prevent them from having that exposure, not only to limit the spread of this virus, but also to ensure that they can continue to live their normal lives.
Yeah, well, Brandon, thank you so much for coming on today, explaining measles and how to combat it and, what it does to our bodies. So thank you once again.
Well, thank you.
All right, don't go away because we have more when we return.